Good afternoon, everyone. I am here today with Dr. Zeraza, our Health Commissioner, our Police Commissioner, Michael Harrison, to give a COVID update as we continue to navigate this pandemic. And we all know our big push is to get residents of Baltimore vaccinated. We are making solid progress. As of today, 69.6% of residents aged 12 and up have received a first or single dose of vaccine, and 61.6% are fully vaccinated. We know, everyone should know by this point, that vaccination continues to be the most effective way to prevent transmission of COVID and limit hospitalizations and deaths. I got COVID almost a month ago and was completely okay outside of being stir crazy, thanks to the fact that I got the vaccine. Some people are still hesitant. So we are working through our vaccine ambassadors and other credible messengers to persuade people that getting the vaccine is the right choice. We are still in a pandemic. People are still losing their lives and getting seriously ill because they are not vaccinated. We want everyone to continue to take in precautions, vaccinated or not. We know wearing masks indoors, continuing to wash your hands, and frequently to encourage your family, friends, anyone that you love and care about to get the vaccine, especially to protect those immune-compromised residents and family members that we all have. And as we continue to navigate this pandemic, the next step is to make sure we protect our young people and our communities. And we are happy to announce that a vaccine is now available for children aged 5 to 11. With school in full swing and the upcoming holidays, now is the time for children to get the COVID vaccine. Pediatric vaccine is crucial to protecting children from COVID disease and reduce chances of children developing long-term effects from COVID-19. It will also, of course, allow us to have our students stay in school, which we know is a critical thing, reducing the spread of COVID in our communities and our schools. I want to thank Dr. Zeraza and Dr. Santelises for their work to ensure an efficient and effective rollout of the pediatric vaccine to get our students vaccinated. We know our young people are safer, happier, and more prepared to learn when they are physically in the classroom. Members of the public who have not yet been vaccinated are again encouraged to visit covax.baltimorecity.gov, that's covax.baltimorecity.gov, or call 443-984-8650, 443-984-8650 to schedule an appointment. Last year, we know we saw a spike in COVID transmission over the holidays, and we want to make sure that that doesn't happen again this year. We want folks, again, to limit travel and large person events wherever possible, get tested before returning to work in large gatherings, and do your part to protect yourself, your children, your family, our community. Get vaccinated if you have not been vaccinated. Together, we can make it to the other end of this tunnel. I'll now turn it over to Dr. Zeraza for our current metrics and more information about our pediatric vaccination plans. Dr. D?
Good afternoon, and thank you, Mayor Scott, for your leadership. I'd like to begin by reviewing our COVID-19 data. As of this morning, Baltimore City was averaging 71 cases per day. This is a decrease of 15% from 2 weeks ago. Our average positivity is 1.5%, a decrease of 20% from 2 weeks ago. We have seen a 7-day average of 107 hospitalizations, down almost 15% in the past 2 weeks. To date, 61,800 Baltimore City residents have tested positive for COVID-19, and 1,227 residents have lost their lives to the disease. As a reminder, the majority of COVID-19 cases nationally are now the Delta variant, a mutation of the original virus that caused COVID, which is almost twice as transmissible. The Baltimore City Health Department and our clinical partners continue to provide vaccine for residents, meeting individuals and families where they are with mobile vaccination clinics in areas of low vaccination coverage. We continue to show steady progress in our vaccination rate, and as Mayor Scott mentioned, 69.6% of residents 12 and up have received their first or single dose. The prevalence of the highly transmissible Delta variant prompted the city to reinstate the indoor mask mandate on August 9th. We appreciate all the residents and businesses who are abiding by the mandate for your role in limiting the spread of disease. City leadership reviews the data regularly to determine if and when it is safe to lift the indoor mask order. Our coronavirus dashboard highlights the key metrics used in decision-making around lifting the mask mandate. We base these decisions on a number of factors, including case rates, deaths, positivity, hospitalizations, the percentage of our population that's vaccinated, as well as the CDC's determination of our community transmission level. When we reintroduced the mask mandate in August, the CDC indicated Baltimore City was experiencing substantial community transmission. The CDC also made formal recommendations that both vaccinated and unvaccinated residents living in jurisdictions experiencing substantial or high transmission should mask when indoors in public settings. Currently, the CDC has indicated Baltimore City continues to experience substantial community transmission rates. More significant and sustained declines in the key metrics that I just outlined will help the city transfer back to a moderate or low transmission rate per the CDC's criteria. And this is what we consider when lifting the mask mandate. While the city continues to experience substantial transmission, indoor masking continues to be an effective way of preventing disease transmission. Last month, the Food and Drug Administration and Centers for Disease Control and Prevention authorized the use of boosters for certain eligible residents who would receive the Johnson & Johnson vaccine or the Moderna vaccine. This is in addition to the previous authorization and approval for Pfizer boosters. This means all vaccines administered in the U.S. are now authorized and approved to provide adult booster doses for the populations deemed eligible by the CDC. In particular, any individuals 18 years and up who were vaccinated with the Johnson & Johnson vaccine should receive a booster dose 2 months after the single J&J dose. Individuals vaccinated with J&J might alternatively receive the Moderna or Pfizer as their booster dose. Anyone who was initially vaccinated with the 2-dose series of Moderna or Pfizer should receive a Moderna or Pfizer booster 6 months after completion of the second dose if you are 65 years and older, or 18 years and older with certain underlying medical conditions, or 18 and older and you live or work in a high-risk setting. The CDC also now allows mixing and matching of vaccine brands for the booster dose only. Eligible individuals can therefore choose which vaccine they want to receive for their booster dose. As a reminder, the CDC also recommends moderately to severely immunocompromised people to consider receiving an additional or third dose of either Pfizer or Moderna vaccine at least 28 days after completion of the initial 2-dose mRNA COVID-19 vaccine series. We encourage residents who may be moderate to severely immunocompromised to speak with their healthcare provider about the need to receive an additional dose. Many Baltimore City providers of vaccines are also equipped to provide booster doses. However, I would encourage residents to call our COVAX call center at 443-984-8650 Monday through Friday from 8:30 a.m. to 6:30 p.m. and Saturdays 9 a.m. to 1 p.m. to confirm that a particular vaccine clinic is able to provide a booster dose. Your physical or digital proof of previous vaccinations will be necessary to receive your booster. As it relates to pediatric vaccinations for children between the ages of 5 to 11, in October, the FDA authorized the use of Pfizer vaccine to safely and effectively vaccinate this group. Just this week, the CDC's Advisory Committee on Immunization Practices also reviewed the data and approved vaccination for this age group as a safe way to prevent serious illness from COVID-19. In clinical trials performed in this group, the vaccine was found to be 90.7% effective at preventing COVID-19. For months, the health department has been working closely with the Maryland Department of Health, city schools, and local healthcare providers and partners to ensure equitable vaccine access for our pediatric population. To date, over 20,000 Baltimore adolescents between the ages of 12 to 17 have been vaccinated through several different access points, including our mobile vaccination clinics at schools, through pharmacies, and through our healthcare partners. From May 14th to November 2nd, the health department worked with partners to hold 140 clinics at 51 city school locations. The Health Department will continue to work with and expand the exceptional team of partners who've been vaccinating Baltimore's teenagers to also vaccinate this newly eligible population. As such, we will be providing pediatric vaccines for children 5 to 11 through our school-based vaccination clinics throughout the city, as well as through our mobile health clinics focused in low vaccination coverage neighborhoods. Pediatric vaccines will also be available through the homebound vaccination program for children and/or their caregivers who are mobility limited and need to get vaccinated at home. Some pharmacies and clinical providers' offices will also have the vaccine available for this age group. Beginning the week of November 8th, the Baltimore City Health Department will offer pediatric vaccinations to 5 to 11-year-olds at select sites throughout the city. Children must be accompanied by a parent or guardian to be vaccinated. Many parents and guardians want to get their children vaccinated as early as possible, and we anticipate you may have to wait in line at the vaccination site, so please plan accordingly. Current clinics for next week are as follows. Tuesday, November 9th, we will be at Dickey Hill Elementary and Middle School from 4 p.m. to 6:30 p.m., located at 5025 Dickey Hill Road. Wednesday, November 10th, we will be at Digital Harbor High School from 10 a.m. to 1 p.m., located at 1100 Covington Street. On Thursday, November 11th, we will be at Access Art from 3:30 p.m. to 5:30 p.m., located at 2446 Washington Boulevard. And on Saturday, November 13th, we will be at the NAACP National Headquarters from 10 a.m. to 3 p.m., located at 4805 Mount Hope Drive. These clinics are taking place in some of our neighborhoods with the lowest vaccination coverage, including Dickeyville, Franklintown, Morrell Park, Violetville, and Howard Park, West Arlington. We will continue to focus our efforts on vaccinating children and families in our low vaccination coverage neighborhoods. We thank city schools, the NAACP, Access Art, and our clinical partners, Ascension St. Agnes and 5 Medicine, for holding the city's first vaccination clinics for 5 to 11-year-olds. Clinic sites offering vaccinations specifically for this population will be listed on our website at baltimorecity.gov/BeMoreVax and on our social media. The schedule is updated every Monday. As a reminder, residents can also call our call center for additional information on where they can get their family vaccinated at 443-984-8650. All of our clinics are walk-ups and no appointment is needed. In addition to our supported sites, for additional pharmacy sites providing vaccines to this age group, you can access the Maryland Department of Health's website by going to coronavirus.maryland.gov and clicking on Find a Vaccine. Lastly, we recognize the holidays are quickly approaching, and even though we're seeing case rates trend down, we must remain vigilant and protect our loved ones who can't get vaccinated or who aren't yet fully vaccinated. If you are eligible to get vaccinated or are due for your booster, get it. In addition to us entering the holiday season, we are also in respiratory disease season, and flu virus is circulating. We recommend that all eligible residents get their flu and COVID vaccines ahead of holiday plans. And as a reminder, the flu and COVID vaccines can be given at the same time. When it comes to holiday gatherings, outdoors is still safer than indoors. During the holiday season, continue to avoid crowded, poorly ventilated spaces. If you're sick or have symptoms, don't host or attend a gathering. Get tested if you have symptoms or have a close contact with someone who has symptoms or has COVID-19. If you're gathering with a group of people from multiple households and potentially from different parts of the country, you could consider additional precautions, such as avoiding crowded indoor spaces before travel or getting tested in advance of the gathering to further reduce your risk. Again, one of the most effective ways to prevent COVID-19 transmission during the holidays, and certainly the most effective way to reduce the risk of severe outcomes from COVID-19, remains being fully vaccinated. So please take the time now, well ahead of the holidays, to get fully vaccinated. Thank you.
Thank you, Dr. D. And with that, we'll take a few questions. Jane?
Okay, so we are about 2 weeks, a little more than 2 weeks past the city's deadline of October 18th for vaccination or weekly testing. So what is, the number citywide agencies of city employees who comply with that in terms of at least one dose? And secondly, for those who aren't complying, what is the penalty?
Yeah, so Jane, last week we were at 48. We're now at above 60. I believe it's at 60, around 65%, if I'm not mistaken, the last time I looked. But that's significant progress, right? When you think about where we were, when you think about some of the workers and the work that they do and how we have to actually get to them. If you're a worker in solid waste, unlike me or someone working in the Abel Woolman building or at the Benton building, they're not walking around with a smartphone or a laptop, and getting the position for them to be able to upload their status was difficult, but now we're seeing it go in the right way continuously. We're going to continue to do that. What we have done is communicated to those who have not that they need to do so, and that not abiding by that, they will hear from us further about the possibility of consequences after that. But right now, it's about making sure first, Jane, before we go into this immediately into this punitive thing, for us, we thought it was important because we know that this was a big thing to uplift, right? To put up the 20-something sites, to make sure that all city workers had equitable access to get themselves tested if they were not, to be able to make sure they had access to upload their cards. We're doing things now where, because we were seeing folks come to the testing site with their Vax card because they didn't have the ability to or understand how to upload that, right? So now we have folks working with them. Now we're gonna, as we work through that, then we'll move to the second phase. But we had to first make sure that we're working with our employees in a very intentional, intense way.
And Dr. DeRosa, if I can just ask you a question, in terms of the doses that have been provided to Baltimore City, separate and apart from, I would assume that's separate and apart from the pharmacies, which get theirs directly from the federal government.
Yes, that's correct.
So at this point, how many doses have been provided to Baltimore City for Baltimore City to provide?
Yeah, so far, just a little over 2,000. And again, the doses will be released in waves, right? And so again, each county is getting it somewhat based, pro rata. And we'll know, like you said, pharmacies are getting their doses separately. We also have some clinical providers, if they were able to take larger allocations, that they might get them directly. One thing I do want to add is very similar to when we rolled out vaccination for adults months ago, we'll continue our hub and spokes model. So we'll absolutely have clinics in partnership with city schools and other community partners, but we also will be transferring allocations to pediatricians. We know that this age group in particular, and certainly our even younger ones, parents want to, talk with and ask questions of their pediatrician. So pediatricians are extremely important in getting this group vaccinated as well. And we've done significant outreach to our local pediatricians and pediatric clinical providers so that they feel comfortable providing the doses to families.
Do pediatricians get their doses separately from the city?
It depends on how many they're requesting. And so I think if it's below 100, then they would work with the local health department. But for larger practices that can take many doses, they can make a separate request to the state outside of the health department.
Thank you. Joy.
Hello. So
Hello.
a couple of questions for Dr. DeRosa. So I wanted to kind of get an understanding of how the vaccine rollout is going right now, because you mentioned that there are a couple of clinics that will pop up for next week. Do we have anything that's going on right now within the schools?
So we have clinics currently for our 12 to 17-year-old age group. So a couple things to understand, again, didn't necessarily note this in the talking points, but the dosing is different, right? And the ancillary supplies and the ability to administer it is slightly different from the doses that we're giving to 12 and up. And so we just received those yesterday. And we also have to coordinate with partners to ensure that we have adequate staff on site. And so nothing happening today necessarily, but certainly early next week we will be vaccinating that group.
And did I hear you correctly when you said about 20,000 adolescents have already been vaccinated in the city?
Yes.
So what's the number for the 5 to 11-year-olds? How many total are there who will eventually get vaccinated or who are eligible to get vaccinated?
So I will get back to you on the exact number for that.
Okay, and I have one more question for you, Dr. D. So yesterday in the governor's press conference, they mentioned that the adolescents 5 to 11 who have gotten the virus now, it's gone up more than 100% in the last 2 to 3 months. Why is that happening? If we've heard that being in school is safe, what's happening with this?
Yeah, so I think it's multifactorial, right? I don't think it's any one thing. Certainly a return to school may contribute some, but we also have significantly increased mobility of parents, right? And so many cases are community acquired. And so if there's more mobility in the community generally, and kids are the unvaccinated group, that makes them the more susceptible group, right? Many of us as adults are somewhat protected because we've been vaccinated, but we have absolutely seen an increase, and again, I think it's multifactorial.
Okay. Mr. Mayor, I'm so sorry that I'm not asking you questions, but I have a question for you, Mr. Commissioner. So we have seen an increase in ATM thefts in Baltimore County and in the city. Do you have an update for us on that, what's happening there?
Yeah, thank you. We know that this morning, officers responded to an ATM theft at 6300 York Road. It was a commercial robbery. You know, we're working to pull surveillance. We're working with our partners at the local level and our corresponding neighbors to make sure we share information to hopefully identify who's committing the ATM thefts. We continue to work and share information about suspect data, vehicle data, sharing video. Last year, we started an initiative to reduce robberies to include ATM thefts. We were able to decrease 58%. This year, we have 29 versus last year we had 70 for the whole year. And so we've assigned a detective to each one of the districts to work exclusively, to work as a liaison with all of our partners to work and share information to help identify people responsible for it. There's no update into the most recent theft other than we know that it's being investigated and we're working with our partners to identify who was responsible.
Emily?
Regarding the youth vaccinations, has there been any kind of goal set or figure that you're hoping to reach? And I'm just wondering how quickly you think you're going to be able, I'm obviously not going to get to 100, we'd all like to, but you know, just sort of what your objective is.
So very similar to the goal we set back in January, February, about 80%, right? Now we know that because their approval came much later, we'll need additional time. And so we would be looking, likewise at, September of next year. So certainly by early next school year, we would love to see 80% of children in this now eligible age group vaccinated.
For Mayor Scott,
Yes, sir.
Curious about your reaction to the appeals court decision yesterday and what plans may be in place to ensure public safety in that area when that rally does take place later this month.
Disappointed by the decision, but the court's decision is the court's decision. Now it's my job, and I've already spoken to the commissioner to make sure that BPD and our agencies are ready to make sure that things are safe and that an order and peace remains. Simple as that. Sir?
Probably for Dr. D on the allotment of the vaccines and how they'll be distributed. Do you need an appointment? You do not need an appointment, and will that change going forward as demand increases? And what are you anticipating as far as demand goes?
Yeah, so no appointment needed. I think demand, we've done a lot of focus groups prior to this point, and it's a mixed bag, right? And so we know that parents that are hesitant are maybe even more hesitant and when thinking about getting their child vaccinated. Again, I think we've been very strategic and intentional in placing our vaccination sites in areas with low vaccination coverage. As a part of that, we canvass ahead of time. And so we work with the school partner because we know that schools can often be that trusted messenger. So we've educated teachers and staff in schools so that they can also begin to have those conversations. And so I think we're waiting and seeing. I think that there will be a high demand for some groups, but we know that other groups will have to do the same or similar types of education for what we've done for other populations.
Sir?
Real quick, this might be for Dr. D. I know you said that you don't know this moment how many 5 to 11-year-olds there are. To put the 20,000 12 to 17s in perspective, how many of the 12 to 17s are there out there?
So, same question. We'll make sure that we give to you guys. I used to know these numbers off the top of my head, how many in the different age groups. We'll give you, it's based on the census data and tell you how many are in this age group. But we know we have, when you think about that there's over 80,000 children in Baltimore City public school system, we know that it's a significant amount on all ends.
Very good, thank you.
Anybody else?
Just a quick question about
Yep, Jane.
distribution of doses. I think the governor said yesterday there are 180,000 doses that have come to the state.
That's correct.
This doesn't seem to be a proportionate number to the population of the city. Am I correct?
No. It's not.
Do you have a response to that?
Well, we know that we have, Jane, I think if you saw, we saw the report from Hopkins, Dr. D and I saw one from Bloomberg this week that said that Baltimore, right, our city, despite all the talking points and all the other things that we've seen, is that out of cities with high population percentages of black residents, that we're number 3, right? We know that Dr. D and her team know how to make sure that we are getting people vaccinated, that we're keeping people safe through COVID. So as we get the resources, we'll work with the state and whoever to make sure that we're getting our young people vaccinated the same way that we have with adults.
Do you have any response to the fact that out of the gate, seems to be a disparity?
Well, listen, we've been here before. We're going to work with them and tell them that they know we need more and how can we get more. Everything else, Jane, is going to just deteriorate into the normal stuff that happens. And that's not, for me, it's about making sure that my most valued thing, our young people, get something that they deserve, are entitled to, and need in order for them to be able to stay in school. I had the opportunity today to speak at the senior inauguration for the class of 2022 at Merville High School, my alma mater, and talking with a group of young people that I talk with frequently, but hearing them talk about how excited they are to be back in school, to be around each other, to be able to have a senior inauguration, to be thinking about prom, to have football games, to be able to travel in 2 weeks because we have a bye week this week, to see our football team play in the playoffs and go along a run to go towards the state championship. Our young people want to be in school and around each other. We have to make sure that they are able to do that, and getting them vaccinated is a great way to do it.
Are the schools dependent on the city's supply?
Yeah, so
School-based vaccinate, well, those are your clinics.
Yeah, so
Okay,
again,
right.
we're partnering with city schools and
Right.
have clinical support from 5 Medicine, as well as St. Agnes, and other clinical partners will be coming on board as well. But yes, we get the supply of vaccine for the school-based clinics.
Okay, thank you.
Thank you.